Right. Meanwhile, the Ministry of Health says it is struggling to stay afloat amidst the dwindling donor support, which has led to a 20 billion shillings gap in funding. The Health Ministry is also saying the 2025-2026 budget policy statement is not sustainable, as they will need more to seal the gap left by donors. Our health reporter Elizabeth Atieno tells us more.
Of the 4.3 trillion Kenya shillings total budget stipulated in the 2025-2026 budget policy statement, the State Department of Medical Services has been allocated 172.6 billion Kenya shillings, while that of Public Health has been allocated 31.8 billion Kenya shillings. However, the Department of Medical Services says it is grappling with an overall funding gap of 254.2 billion Kenya shillings, as they required 426.8 billion Kenya shillings in order to fulfill their obligations.
Operations and maintenance of Kenya shillings 500 million. The State Department is overstretched due to many activities being undertaken in implementation of the universal healthcare coverage and transitioning of the Social Health Authority.
The Department of Medical Services says it has a budget of 91.8 billion Kenya shillings in the 2024-2025 financial year, which constitutes of 64.2 billion shillings under recurrent expenditure and 27.7 billion Kenya shillings under development. Additionally, there is a total of 68 billion shillings on development and funded priorities, including 30 billion Kenya shillings earmarked for provision of a fully public-funded primary healthcare system and 15 billion Kenya shillings in the procurement of strategic commodities like HIV, family planning, and vaccines.
You know that we are currently facing also a huge gap on condoms. We have about 22 million Kenyans who are sexually active between the ages of 15 to 49. We currently have a gap of about 1.5 billion for condoms.
With the declining donor support, the country needs 3 billion Kenya shillings to cater for blood transfusion after the World Bank withdrew its 1 billion Kenya shillings support this year. An additional 20 billion Kenya shillings is needed to cover for the USAID funding challenges.
The health, in the current estimates, we have 4 billion. When you check at our proposal for the year 25-26, you will see we have 61 billion.
The dwindling donor support has equally affected key critical state parastatals like the Kenya Medical Research Institute, KEMRI, which says it has not received a single cent from the 400 million Kenya shillings needed to enhance its research capacity, as well as the 100 million Kenya shillings needed for staff transition. Elizabeth Atieno, TV 47.